everyone. This is Emily with Senior Helpers, and today we're joined with two members of our community. We have Kate with Ability Home Health, and we have Savannah with Fort Collins Family Acupuncture. So we're going to start off with Kate today, who's going to be talking about some differences with home health and home care. Was that it?
Yep, that's right.
5 seconds ago, and I already got it wrong. We're just that I need to get some in-home care. So we'll start off with Kate first, and then we'll go over to Savannah next. All right, take it away, Kate.
All right. Well, thank you again, Emily, for having me on the show today. I really appreciate you and everything that you guys do at Senior Helpers, and certainly appreciate being part of your Wellness Week. Today, I'm going to talk about something quickly that I could probably spend months, days, weeks talking about. It's actually what I talk about quite often, and it's the difference between medical home health care and non-medical home care, which is so confusing for many people in our community. And I do spend a lot of time with usually daughters kind of explaining the difference between our programs. So I'm just going to take a few minutes to talk to you guys about it, and then because there's going to be like a billion questions, I hope you guys can reach out to me directly, and we'll continue the conversation. But I'm going to do a brief kind of overview. So the names alone are confusing, right? Medical home health care and home care. Home health care, home care. And sometimes people intertwine those terms, but they do definitely mean two different things. So with medical home care, home health care, which is what we do at Ability Home Health Care, the people who are providing the care are medically trained professionals. So they're registered nurses, physical therapists, occupational therapists, speech therapists, social work, CNAs, and these individuals are hired, usually ordered by a doctor after a medical setback to kind of get you back on your feet again. While non-medical home care providers don't have to have any sort of clinical licensure, but they do have usually some training through the agency that they work for, and a lot of times experience in the field of healthcare or senior care. And these individuals kind of do, I like to say, whatever a family member would otherwise do if they were available to do so. So they can do light housekeeping, meal preparation, transportation to and from appointments. They can sit with your loved one during an appointment and then tell your other loved ones what really happened. They can do all sorts of things. And with medical home health care, usually, like I said, you're receiving those services following a medical setback of some kind, whereas non-medical home care can come in anytime when those day-to-day tasks become a little bit difficult to manage for a senior. So that can be anything, like I said, from light housekeeping, meal preparation, transportation, and can be provided at any time. So you can say, hey, senior helpers, non-medical home care, we'd really like you to go sit with mom 3 times a day for 2 hours at a time just to get her up for the day, come back during the lunchtime, make sure she's taken her medications, and then maybe come back at dinner time to make dinner and get her settled for the night. Whereas home health care services are much shorter in duration, and the frequency and duration is specific to each patient. But usually on average, at Ability at least, you're seeing us on average for about 40 days. And that's not necessarily every single day. And again, it's just to kind of get you back on your feet following a medical setback. So that can be nursing care to kind of either treat wound care or IV antibiotics and help you through that process, maybe set up a better medication regime, or teach you and talk to you about your medical condition, physical and occupational therapy to really give you tips and tricks to make home work for you. So give you equipment recommendations, home modification recommendations. With a speech therapist, they might help with not only swallowing, maybe following a stroke, but maybe you're helping with cognitive issues as well, like organization, and kind of getting all those executive functioning skills working. So usually it's just on a short-term basis where, again, non-medical home care is more scheduled. So where is it provided? That's a big difference too. Well, not a huge difference, because really non-medical home care and medical home health care are going to come to you wherever it is that you live and where you call home, whether that be in your house, in your daughter's house, in your assisted living community or independent living community. With medical home health care, once you get to the nursing home level of care or skilled nursing facility level of care, that's not something that you would have medical home health care then come in to help with, because the professionals in that level of care are equivalent as far as skilled training. But non-medical home care can still see you when you're in a skilled nursing facility. And the biggest reason is because of payer source. So medical insurance pays for medical home health care. Again, just on a short-term basis to kind of get you back on your feet following a medical setback. So your Medicare Part A is going to pay 100%. A lot of your Medicare Advantage plans like Anthem or United Healthcare or Humana, those different plans may have a copay involved, and they are much more limited on what they're going to authorize for medical care. But in non-medical home care, it's private pay. So you get to determine how much you can afford, essentially. Now, there are other programs out there outside of the ones I've described that might be able to support you more on a long-term basis. And that's either going to be private pay again or under Medicaid. So if you spend all your money and can't pay for it anymore, Medicaid can sometimes kick in and pay for that long-term support that you need. There are also veterans benefits out there and available to pay for your non-medical home care and long-term medical care services. So really, kind of depending on your situation, it's worth giving either me a call or giving Emily a call and just kind of saying what your situation is and what it is you're looking for, and we'll be able to guide you appropriately. But two very different programs, but we do work very closely together. There are many times where we'll provide medical support to somebody in their home, but they're not able to get to the bathroom independently. We're not there 24 hours a day, but you can pay a non-medical home care company to come in and be that support for you when we aren't there or when your loved ones can't be. So we definitely refer to non-medical home care services quite often, and I know that sometimes as they're caring for people in their homes and they see a decline in health, they'll a lot of times call me and we'll bring our nurses and therapists in to kind of get people back on track. Both of these programs are awesome, and there's a lot of options available in the community. If you'd like to talk more about it, definitely let me know or give Emily a call and we'll be happy to help you out. I hope this information was somewhat helpful, and yeah, let me know.
Thanks so much, Kate. Yeah, I think everyone who was watching probably found this very informational, very helpful. Just reiterating, if anyone has any questions about either medical home health care or non-medical in-home care, just reach out to one of us and we can either get you connected with the other one if you need it, or we can just answer your questions and help you out where needed. So thanks so much, Kate, for joining us. We're going to switch over to Savannah now. Thank you. All right. Savannah is joining us from Fort Collins Family Acupuncture. I go and see them every week. I love them. So I'm having them on today to share some healthy aging tips from a Chinese medicine side of things. So Savannah, if you could unmute yourself and give us some tips, that would be great.
Sure.
Hear me, Emily? Can you give me a thumbs up if you can hear me? My internet's working properly.
Savannah, you're kind of cutting
This is working
out.
properly. So my name is Savannah Russell. I'm with Fort Collins Family Acupuncture, and we do Chinese medicine, acupuncture, a lot of the stuff that we do is nutrition based. Emily's coming back on. Let's see. So eating with the season are really big on eating and living with the seasons, and part of that is that each of our organ systems are affiliated with a specific season in Chinese medicine, and it's important to make sure that everything stays in balance. So in the summer season, it's the heart and small intestine that are associated, and blood throbbing. And when the small intestine is in balance, then you have really good digestion and proper assimilation of nutrients. And so time is a season of a lot of yang energy, movement, and big, strong stuff. So we want to make sure that we're cooling and hydrating the body. And so one of the ways to do that is drinking a lot of water. We all know we should be doing every day anyway. Vegetables are very abundant. So a lot of fresh fruits and vegetables. This is the time to eat salads, smoothies, a lot of fresh fish. Those are all things that are going to help hydrate and cool the body. And so we're often, in Chinese medicine, we often talk about how really cold foods can harm your digestion in colder seasons, and people love their smoothies, and we're not going to tell you to not have your smoothies. There's just a time and a place for them, and summertime is one of those. So things that we really like to eat a bunch of are watermelons, strawberries, summer squash,
Okay, I think we might have lost Savannah there, but she did give me a handout, so I will be sure to attach that to this video and so that everyone gets it. But hopefully we'll have her on again and she'll be able to share some more tips with us. But for now, I'm just going to say thank you to Savannah and thank you.
You could do spare.
Oh. All right. Thank you to you both. I'm sorry to cut you off, Savannah. It's just very hard to hear. I'm definitely going to include your document along with this video so that everyone can get those good tips. But as for next time, we might have to work a little bit on connection. But thanks to you both, and thanks for everyone who joined us. You guys have a
Thank
great
you.
day.
Yep. Bye, Emily. Thanks a lot. Have a good afternoon.
You too.